People attend the clinic here in Mount Isa with hip pain on quite a regular basis. Now, this here is the anatomy of the hip. This is the top of the leg here. This bit here is called your greater trochanter, and that's the sort of bit that sticks out the side of your hip that you can generally feel. And you'll notice all these muscles around here, these are your gluteal muscles, and they attach into the femur here, around the greater trochanter. We also have a little fluid-filled sac here, which is called a bursa. And bursas are all over your body. They basically sit there to keep structures apart from each other and allow the joint to sort of be lubricated and sort of allow it to biomechanically work the way it should. Now, sometimes that bursa can get inflamed and therefore you develop what's called bursitis. And bursitis of the hip can be very painful. You can't lie on it. You generally have pain around this area here. And it gets quite uncomfortable to basically have any pressure on that area. And there's a couple of different things that you can do for that. Some people will go for a cortisone injection into that area, which is one way of settling it down. However, you've really got to look at why that's occurred. So the inflammation will occur in the area for a particular reason. It's not just going to become inflamed on its own. Usually there's around there, such as something to do with these gluteal muscles, the alignment of the hip and the femur, and that can sometimes even come all the way up from people's feet in regards to where their forces are going. So as opposed to sort of just taking the quick and easy fix of trying to stick a needle in there's lots of things that physiotherapy can do to help. Lots of taping techniques, doing a biomechanical assessment of your hip to see what the alignment's like, and then treating the structures around it accordingly. So if you're struggling with sort of pain in your hip and you think it might be due to trochanteric bursitis, then pop into the clinic in Isa and we can have a little look. We'll go through an assessment with you and we'll settle down your symptoms.